The reason I chose public health is because I want to help people and I want to make the world a better place. So growing up, I never really knew or had a specific ideal of what I wanted to be. I moved to Southern California, and there I got into personal training, and I loved it. It was great, and I knew that helping people become healthier was definitely a passion or calling of mine. And through that I realized, hey, I still have an appetite for knowledge. I still want to learn. I think I want to go back to school. I learned about the public health program at UB through the application process, and reviewing the website and talking to some other people who are already in the program or went through the program. I realized that this was what I've been waiting for. One of the great things I love about the program here is the real-world practical experience that you get, and part of the program requirement is to do a field training experience. Working anywhere in the world, actually, you can work and get that real-world experience. And I did mine for the Genesee and Orleans County Department of Health. My main area of interest in epidemiology is in infectious disease, and when I expressed that to my site advisor, he let me know that they were actually beginning a Zika virus surveillance program, and that would be a perfect opportunity for me to learn some real-world application to infectious disease surveillance. As part of the mosquito surveillance program, the first thing that we obviously had to do was trap mosquitoes. The County Department of Health had 4 mosquito traps that we had, and basically I was in charge of developing a system to make sure that we knew that which trap and all the parts were where they were supposed to be and accounted for at all times. Once the mosquitoes are trapped, we need to identify them. So we would take the mosquitoes back to the office and look at them underneath microscopes. And we had a pretty neat little tool. It's a combination camera and magnifying glass. So you hook it up to the computer, you kind of set it up with a magnifying glass, you can see the picture, and the great thing is it can record the picture so you can examine it later, research if you wanted. Really cool thing that has happened was that they got a drone this past year, which I did get to fly, and it was pretty awesome. And they're actually thinking about developing the drone to be used in the mosquito surveillance program. They can use the drone to fly over and identify spots that might be really good areas for mosquito surveillance. So it's a really exciting thing, and I know that they're pretty pumped about it too. Well, data is huge in epidemiology, so one of the really important things that we needed to do for this was collect data. So part of what myself and my site advisor had to do was come up and develop a data collection form that would capture all the relevant information that we needed for the surveillance program. I truly enjoyed my field training experience at the Genesee and Orleans County Department of Health. It was really nice to be able to get to take a lot of the things that you learn about or hear about in school and put them into practice in the real world, whether it be some of the challenges that you hear about and actually experiencing them and learning how to overcome them, or even just seeing what you're doing making a difference in the lives of people in the community. It's just a really great experience. I would tell somebody that if you're interested in helping people out, you should absolutely consider a degree in public health. I think that it gives you an opportunity to have a lot of cross-collaboration with a lot of different disciplines and to truly actually make a difference in the world